Good evening, and welcome to Future Choices. My name is Fran Snedeker, and I am the producer and moderator of this educational series exploring reproductive health issues, filmed at the LMC TV studios in Mamaroneck, New York. Future Choices is a child, albeit reluctantly, of the George Bush presidency. For the past 5 years, we have described the damage inflicted by the Bush administration on sexual and reproductive health in this country and in the developing world. Well, now America has elected as our president Barack Obama, who in his first several months in office has lifted the global gag rule, established the White House Council on Women and Girls, and more. The good news has started already. However, much remains to be done to bring family planning into the 21st century in this country. To this end, the venerable Guttmacher Institute has just released a comprehensive research report which spells out the extent to which family planning is the critical safety net we need, especially in these hard times. Future Choices is very pleased to welcome the lead author of that research report, Rachel Benson Gold.
Thank you.
Rachel is the Director of Policy Analysis for Guttmacher, and she's here today to talk to us about that report and the way it relates to us here in Westchester County. Welcome, Rachel.
Well, thank you very much. I'm delighted to be here.
Rachel, please tell me, what are the most significant challenges and opportunities in family planning in the U.S. that your research has uncovered?
Sure. Well, thank you, first of all, for inviting me here today. And I think you already alluded to one of the most significant opportunities, which is the election of President Obama and the arrival of new leadership in Washington, both on Capitol Hill and at the White House, that I think is going to open, at least we hope will open, many new doors to us that have been closed for 8 very long years now. But I think, just stepping back for a little bit, I think it is fair to say that we have come a very long way in our national effort to provide family planning services to all of those disadvantaged women in need. Family planning centers, like those operated by Planned Parenthood here in Westchester, are located in about 75% of all counties nationwide. So about 3/4 of all counties nationwide have at least one publicly funded family planning center.
But there are counties that are unserved.
Yes, about 25% of counties have no family planning center. And along with a significant number of private doctors that see women who are paid for under the Medicaid program, family planning centers and private doctors serve about 9 million disadvantaged women every year. That's not an insignificant number. And by providing contraceptive services to those 9 million women, we enable about 1.4 million women each year to avoid an unintended pregnancy, which means that we are avoiding, about 800,000 abortions every single year in this country as a result of publicly funded family planning services.
Now, when you're saying disadvantaged, tell me who you're talking about. What's the definition of the people that are served by the government subsidized family planning?
Well, technically, when we talk about women in need of publicly funded family planning, we mean low-income women and young women. And those are really the two groups that, according to the official definition, fall into that category. But I think as we're seeing it, I'm sure you're hearing this from family planning centers here in Westchester County, and we're certainly seeing it nationwide, that definition is very fluid. And during hard economic times like this, we are seeing an uptick in women coming into these centers and saying that they simply can't afford the contraceptive services that they need, even though perhaps last year or 2 years ago they were not in this sort of economic situation. So it's very sensitive to the economic conditions on the ground.
That uptick is being documented already.
Well, I think we're seeing from all sorts of anecdotal evidence that just more women are coming in to family planning centers, and we've heard that from centers across the country. And I think that really points to the sensitivity of the services and the need that women feel for these services and how important these services are to women. And I think that's one of the fundamental findings of our report, Next Steps for America's Family Planning Program, that family planning services really are basic health care for women. Mm-hmm. That it is true that 1 in 4 women who come to a family planning center, 1 in 4 women in this country who receive contraceptive services every year do so at a publicly funded family planning center. That's a huge number. Mm-hmm. But when a woman walks into a family planning center, they get a package of care and a package of services that is virtually identical to what I get from my private OBGYN in my annual visit. It's, contraceptive services, it's, a Pap test, it's a pelvic exam, it's testing and treatment if necessary for sexually transmitted diseases. And all of that happens in the context of a family planning visit. Mm-hmm. So if 1 in 4 women in this country who get contraception do so at a family planning center, 1 in 6 women in this country who get a Pap test or a pelvic exam every single year do so at a family planning center. And 1 out of 3 women nationwide who are tested for HIV or who are tested or treated for sexually transmitted infections receive that care at a family planning center. So it really is just basic preventive health care for America's women. It's therefore not surprising that 60% of women, 6 in 10 women who go to family planning centers view that center as their usual source of medical care. That's where they look to for their health care. That's their entry point into the healthcare system. So we are not talking about, kind of an isolated fringe set of providers. We are really talking about a critical part of our healthcare safety net in the United States.
And when you say young women, how young are you talking?
Family planning centers are, there to serve, women of reproductive age who are sexually active, who need their services. They are very careful and committed to encouraging family involvement in when young women come in for contraceptive services. Mm-hmm. But at the end of the day, family planning centers will provide confidential services to the teens who need them. Because simply the costs of and the consequences of not providing the services are greater for a woman who is sexually active and really very much needs to avoid an unintended pregnancy.
And just to make sure that the record is clear, when we're talking about federally subsidized family planning services, we are talking about family planning services, but not abortion services.
Yes. There is a very sharp distinction between, in federal programs, what is family planning and what is abortion. Mm-hmm. And the family planning services that are provided with public dollars, with federal dollars at these family planning centers are contraceptive services, Pap exams, Pap tests, pelvic exams, STI testing and treatment. They will provide non-directive counseling, fair, balanced, objective counseling on options to a woman who is found to be pregnant, who comes into a family planning center and gets a pregnancy test, but they will not clearly provide the abortion services with these federal dollars.
And here in Westchester, how likely am I as a resident of Westchester to encounter somebody who is, I'll quote, woman in need, who will want to avail herself of a Planned Parenthood or a subsidized clinic or Medicaid?
Probably more likely than you think. According to our recent research, there are in Westchester County, and this is in 2006, there were about 41,000 women who are considered in need of publicly funded family planning services. That means that they are sexually active, able to get pregnant, not trying to become pregnant, and they are either teens or adult women under 250% of poverty.